Hi, I'm Kristine Dixon.
And I'm Sarah Morrow, and you have tuned in to Acorns to Oaks.
Yes, welcome. You
Today,
sound perfect.
we are going to be talking about something that is near and dear to both of our hearts, I believe, and that is working with medically complex children. So that means kids that have neurodevelopmental disability in addition to a medical challenge. So things that might be included are epilepsy or cerebral palsy, sometimes have some medical challenges, and then other genetic disorders as well,
Yes.
which cause a lot of challenges for the family and for the child just in daily living. And it's a lot for the parent to coordinate. So we're going to get into that a little bit today.
Yeah, and hopefully this can help.
Yeah.
One of the things that came out during the pandemic is the entire world learned the word comorbidity. But that really means, what does that mean, Nurse Sarah?
So comorbidity means that you have more than one diagnosis, essentially. And really, it's very common throughout the lifespan to have more than one diagnosis because not everything falls into one box. And often, if you have one challenge, then another part of your body may be affected as well. You may have additional diagnoses and additional challenges, a lot of medical needs, a lot of medication needs, which really affect the day-to-day living for the child and also for the family.
Yeah, so some children that have autism or people with autism, they can have some medical fragility around that because if you meet one person with autism, you really just meet one person with autism. Neurodivergent really is the word because there's a diversity amongst the diagnosis. So in dealing with medically fragile individuals, which we have the pleasure of doing, it requires a little bit more coordination and care. And it can be very stressful on the parent if your child has some of these additional diagnoses, epilepsy, OCD. But first question, how do you coordinate autism care with complex medical needs?
That's a great question. And I think from our perspective, when we are working as behaviorists in the home with a child on the spectrum who also has medical needs, the medical needs really need to be the priority. So often our clients have nursing staff with them, and they really are the ones that are leading the charge in terms of the day and the health activities of that day for that child. So we really work as a team, we collaborate, and we also defer to the nurse's expertise on the child's health and what needs to happen.
Absolutely. And there has to be coordination and communication. So when we walk into that home, the first thing we're going to do is check in on the physical and status of the patient in terms of how are they doing today? How did they sleep? How is it going? What's the update? And the nurses usually do give you a good update of what's next on the agenda that they need to do. Yes, you also need to coordinate with the developmental pediatrician. There's a lot of coordination of medication. When would be the opportune time to give the medication, the effects of the medication?
Yeah, so it's really important to follow what is happening after that medication has been given or if there's been a medication change. Um, Medications work differently in everyone. Dosages sometimes need to be adjusted. There are side effects that can occur. So it's really important to work together to know what those possibilities are and what we can do to mitigate any discomfort if possible. Um, you mentioned the developmental pediatrician, which I think is such a big support for these families. Not everyone can have access to a developmental pediatrician, which is unfortunate at this time. So some people may have what they call a medical home, which is like a primary care provider, nurse practitioner like myself, or a physician that sort of assists in helping the family, guiding them through an unfortunately siloed medical community, right? So you may have your nursing team, your primary care, your speech and OT, us as behaviorists. You might have a registered dietitian if there's tube feed or other feeding concerns, nutrition concerns. You might have a neurologist involved with medications. Certainly our epileptic patients and clients would have a guidance from a neurologist. But it can be a lot. It can be a lot of different appointments, different therapies, who's coming when, where do we go, how do we get there on time? And then with a medical complexity, you're also facing a likelihood of an illness and missing appointments and having to reschedule. It's so much coordination for the parent. I've had parents tell me they struggle a lot with insurance and getting enough oxygen, for example, if they need it, because you're really allotted a certain amount. But if that changes and then that order doesn't go through, or for some reason there's a miscommunication, now this parent is scrambling to get something, you know, that will keep that child alive. So I can't imagine really the daily stress that these people have to cope with. And I know that we work really hard to try to lessen that as much as possible.
Absolutely. I think it's also really ethically important to have a safety plan when you're dealing with epilepsy, and that safety plan is approved by the nurse and by the team.
And it's so important that you mentioned that because everyone needs to be on the same page. If there is an emergency that occurs, some unexpected adverse reaction to a medication or a seizure, or or maybe we're having a major digestive problem, a blocked tube. These are things that we really have to be able to act quickly to mitigate the risk for the patient, and also to work as a team to take that stress level down, be calm in the moment, and be able to take the right steps.
With medically fragile individuals, you can really see where the insurance companies and the medical model is somewhat failing patients and individuals because
100%. Yeah.
they don't cover everything. And they kind of say, well, you're going to be the nurse now, and
Mhm.
you're going to do all the care. But the parents can't do all the care. And I think that's what makes me so incredibly grateful still that we live in California and that we have the regional centers in California, because they at times will put together the most beautiful teams of nurses round the clock
Mhm.
or respite for the child so that the parent can also work and provide the money to get the insurance, to get the treatments.
Yeah. Yeah, I've had parents tell me that they feel they have to roar to get their needs met. They have to not only be the parent and the medical provider and the advocate and the person providing all of the financial structure behind what the family needs. It's incredible how much stress these families are under. And I think that there are some resources out there and there are some supports, but you're absolutely right. The regional center does provide at least a broad spectrum of services for that child's individual needs, which is wonderful.
And the medical model at times really doesn't provide the answers or the round the clock care needed for a lot of these medical fragile individuals that just need a safety plan, you know.
Mhm.
You need to review the medications. You need to know the signs of distress
Mhm.
on the case, looking for these signs constantly. So we're talking about medically fragile individuals, comorbidity with an autism diagnosis, and just the extraordinary amount of care that needs to happen when you're doing behavioral services for these individuals, when you're lucky enough to be able to be trusted. Because it comes with a great deal of trust when
It
you
really
take
does.
on cases like this.
Yeah.
And we're so lucky at Nurture Nature because we have Nurse Sarah, um, and you've been a tremendous resource at
Thank
looking at the
you.
medications and approving safety plans, when there's epilepsy and looking for side effects of meds. And, if this happens or if that happens, we need to stop
Yeah.
immediately
Yeah.
and just do a health assessment and on the spot. And
Absolutely.
that goes a long way. How does autism affect the management of chronic medical conditions?
I think that's so fascinating because so many of our clients inherent to their autism struggle with communication. So they may not be able to tell you, I feel this in my body. This part of my body hurts. It hurts when I do this, right? So we're really relying on our own observational skills to say, hey, I know this child pretty well. And today something doesn't seem right. Um, Also, we're so fortunate to have such a supportive team at Nurture and Nature. Our therapists are so prepared to go in and assess the situation. How is the parent doing today? Should I really be asking them questions or doing parent training right now? Or are they at their limit and we need to focus on something else today. Also, how's the child doing today? Are they really tired? Am I going to place a lot of demands on a really tired child? I don't think so. Um, Also, I think that our staff is really great at enriching the lives of these children.
Yeah.
They bring some joy with them in the door every day.
Well, that's what it's all about, right?
Yeah.
Bringing positivity, joy, hope, growth through positive experiences. And that's really what you want is you want to create as many positive learning opportunities as possible. And
Absolutely.
so it's just all about bringing in, the fun and bringing in the toys and because some of the medically fragile individuals we serve have severe deficits in terms of mobility.
That's absolutely true. And I think it's really helpful as well when our team is able to display that progress. Because when you're the parent in the home and you're dealing with all of these responsibilities, you may miss the little things to say, "Hey, look, he actually did that today." And see what progress he's making and how fantastic he's doing. So to be able to emphasize the positive for these families, I think is crucial.
Yeah. How can sensory sensitivities impact medical procedures or hospitalizations?
Yes. So this is a big one. When a child is hospitalized, they're out of their routines, they're out of their comfort. We don't always know, hey, how does that sheet feel on your skin? Because it might feel different than it would to me, right? Also, lights and sounds in hospital, it's a lot. There's a lot of things going on there. It's not a quiet place often. So that can be really overwhelming for clients that are very sensitive to sound or very sensitive to light. Um, One of the things that I think about as a nurse anytime I'm walking into a patient's room is this kind of a new idea to me, which I heard on another podcast about texture. What do you bring into a room? Do you bring in softness? Are you a sense of calm? Are you a sense of patience? Do you come in a little irritated? Are you maybe a little bit bringing friction with you when you don't need to? So I think setting your intention as to what you're bringing into the room and the type of care you're going to provide, especially for a child with sensory needs, you're really going to determine your success, I think, based on how you're able to interact with that child before you do any sort of medical procedure.
Great answer. And a lot of times we help children and adults prepare for these medical surgeries or testing or
Yes.
blood getting drawn or going to the dentist. And the preparation is really key in terms of decreasing fear and anxiety, priming.
Yeah, so I think the dentist is a great example. A lot of our clients really struggle going to the dentist. It's really scary for them. Again, you have lights, you've got sounds you're not used to, you have smells that are maybe overwhelming, and then there's just the fear of pain. Um, I think that we've done some pretty great work of slowly desensitizing the child even before they walked into the office. You know, practicing putting the toothbrush in their mouth, and you open your mouth, and I'll put something in there, and we'll take turns so that we can be less fearful about people approaching a sensitive area. Um, and there are even some dentists that you can make a really good partnership with and practice. We're just going to go and sit in the lobby today. We're just going to go and sit in the chair. You're not going to have an appointment, but we're going to just go into the room and slowly make it more and more comfortable so that the long-term health outcome is better.
Yeah, because if the initial is aversive, um, the child might put up resistance to going. And so I think what you're alluding to is like, at Nurture Nature, we play doctor and we play dentist. And
Yes.
I know that sounds kind of naughty, but what we do is actually we bring out the toy kits and it's like,
We watch the videos. This is what
yeah,
it looks like to go to the dentist. This is,
yeah.
just
And
to
we
help
let
them
them play
prepare.
with the tools and we let them put the mirror in our mouths
Yes.
and we
Yeah.
we play, dentist. And I think that does go a long way empowering the child.
Yeah.
Whenever we like to play vet at the
Mhm.
clinic, and so we bring out the doctor's kits and they're the vet and we have a bunch of stuffies. And every time a child brings out the doctor's kit, they're always like, "You need a shot." And I think that's really empowering for little ones because they're in the control position.
Mhm.
And, they get to give you the shot and they're always like, "Did it hurt?" And it's like, "Ouch, yes." And they're like, "Put a Band-Aid on it, make it feel better." It's like, "Okay."
Yeah, it gives them
But
a chance to explore that experience in a
yes.
pretend way.
And also in a powerful way where they
Yeah.
get to take the power, and so, I do think that goes a long way in decreasing anxiety. Some medical procedures you can't prepare for because 'cause they're on the spot, and it's like, "We have to go to the doctors now."
Yeah.
And in that case, it's like, bring some stuffies, bring some
Yeah.
friends, like.
Yeah, and that's something that we've also done, with our therapists, have, like, a go bag. If we're going to the hospital with the client, we have toys, we've got activities, we've got things that will help to make them more comfortable in a strange environment, and especially at a time when maybe it's an emergent situation and we feel like we need to move quickly, just to try to help ease that transition because it can be really scary for the family, but also for the child.
Yeah.
Yeah.
We're also so lucky because in Los Angeles, we have Children's Hospital of
Mhm.
LA, and that hospital is phenomenal of making it fun. They have it's just
Yeah.
it's fun for the kids to walk into. They've really done a really nice job designing that and making it
Yeah.
very engaging and also very soothing. So sometimes children need to be engaged and sometimes they need to be soothed and
Mhm.
reading those cues of distress and
Yeah.
early signs of distress are like clenching fists, your fist,
Wincing.
wincing,
Yeah.
biting your lips,
Mhm.
looking down, closing your eyes.
Blood pressure increases, respiratory can increase as well. Yeah.
What are common medical conditions that co-occur with autism?
Yeah, so commonly we'll have ADHD could be one that is another condition very likely to have an autism diagnosis. We have certain genetic disorders which can be different, depending on the child, can be something that is brand new that has never been seen before. We can see cerebral palsy, very common co-diagnosis, which can affect mobility and can come with other medical challenges. Certainly, epilepsy, seizure disorders, very common. Also, a lot of our kids are from premature births, and so that comes with their own challenges, respiratory issues, sometimes other mobility problems, digestive problems are so common in the autism community as well. So really, it feels like an endless list, and that's true really for all of us. If you think about different diagnoses people have throughout the lifespan, um, I think when you have a child on the spectrum with these diagnoses, there are additional challenges that we sort of touched on a bit in terms of sensory and expecting certain rigid, restricted schedules that may be affected by appointments and where you have to go and what you have to do for your physical health. So there are a lot of challenges for that community, and every child is an individual.
Yeah.
Yeah.
So, for example, sometimes you can use Primene and it can decrease anxiety and have a really positive effect.
Yeah.
You're going to the dentist today
Mhm.
and it's going to be great and you're going to bring Stuppy and you're going to get a prize at the end from the treasure box and he's got to put stuff in your mouth like we've been practicing and then other times you can use Primane and it can actually amp up anxiety and trying to like you're going to the dentist tomorrow, you're going to the dentist in 3 hours, you're going to the dentist in 2 hours, you're going to the dentist in an hour and it's like I don't want to go to the dentist. I'm late. So you really have to gauge from the behavior tells,
Mhm.
take the
Yeah.
what we're seeing,
Yeah,
what
and
the
I
child needs in the moment.
absolutely, and I think you point out something that's really important as well, and that is, the way that we present it, our anxiety. If we're afraid that this could be something that the kid will not like, and I'm worried about it, and the more I talk about it, the more worried you get, and now we are feeding off of one another's energy in terms of, "Oh, we're both so anxious," where if we frame it slower and over more period of time of we're gonna drive the car to this parking lot and we're gonna go inside and people are going to be very kind and then we'll have your teeth looked at and after that then we'll do something fun, right? So it kind of helps to have a picture in your mind of this is going to go okay, we're gonna do all right, we're gonna get through it and we don't need to be afraid. I think that's really helpful.
Yeah, positive thinking,
Mm,
can-do attitude.
absolutely.
It goes a long day. And if you go into it thinking this is going to be a train wreck, your expectations are probably going to be met. Yeah. Yeah. So positive thinking. How do you distinguish between a medical problem and a behavioral concern? This level of discernment, we're training our clinicians on it, but it can be tricky to
Yeah.
tell. Yeah.
Yeah. Yeah. And, certain seizures can look even like behavior, for example, an absence seizure, which is really hard to identify because it just looks like, oh, we just looked off in the distance for a moment and then came back. Um, are you just not paying attention to me, or are you having a medical issue? And I think we really need to err on the side of let's rule out the medical issue first.
Always.
Yeah,
Yeah. And that's what our ethics say to do is like
absolutely.
do nothing until you've ruled out medical causes or pain attenuation is what
Mhm.
we call
Yeah.
it. And that's really important for ethical practicing of ABA is really ruling out medical causes. So
Yeah.
another really common example would be if like a 7-year-old little girl starts having accidents several days in a row,
Mhm.
where she hadn't had accidents for a year.
Mhm.
That's where we would say you need to go to the doctors and rule out like a UTI that might be
Absolutely.
causing this,
Yeah.
you know.
Yeah, and again, the child doesn't know what these feelings are, so they might not have a way of communicating. I couldn't, I couldn't help it. So yeah, absolutely. Anytime that there's any medical concern, we want to make sure that's being looked after first.
Yeah. Pain tolerance is different in every person, correct?
It is.
But
Yeah.
what signs of pain might look different in autistic individuals?
Yeah. So I think maybe an increase in irritability. Um, you know, you might see more outburst behaviors. You might see increased rigidity, less of a tolerance for change in the environment. Um, Again, like they may not indicate to you what body part hurts or even necessarily like grab their stomach or grab their head because they might not experience it in the same way. You're absolutely right that everybody has a different pain tolerance. Um, and that goes for our children as well. Uh, if they do have a neurological difference, that pain signal might even feel very different to them than it would to someone else, right? So it's really, I think, good to get to know your clients and get to know what is normal, what's our baseline. And then when there's something that is outside of that, then that's when we really need to collaborate with the whole team and make sure that the child is getting the care they need.
Absolutely. And that's one of the reasons why I like the functional analysis screening tool
Mhm.
as one of the indirect assessments that I utilize during like a functional behavior assessment because I think it's question 9 and 10. Don't quote me on that, but I think, we ask like, well, what does your child present like when he's ill?
Yes.
And that's when a clinician or a BCBA really needs to pay attention to see like what does that look like? Are they hyperactive or do they shut down and just sleep all the
Yeah, it could be
time?
completely opposite responses from one child to another.
Yes. Looks like the doggies are joining us. My BF Skinner dog.
They're always welcome.
Yes. Um, tooth pain can happen, wincing when drinking hot or colds, pain when brushing teeth.
Mhm.
Very important to notice all these signs of pain might look different in different individuals. How can caregivers improve communication with medical providers?
Oh, that can be a challenge.
I think it's important that parents prepare for the appointment and write down their questions in a
Absolutely.
book because in the moment you are getting so much medical information
Mhm.
that at times you might forget the questions that you really wanted to ask.
And depending upon the type of appointment, the provider may be very rushed as well. And you really don't have a lot of time. So having something written down is really wise.
Yeah, I like that. Even when I go, okay, I have some questions for you. Let me take out my book here. And they're like, she has a book.
A thought on the medical list. Really important to have the medications and dosage from every provider on one list. It's helpful for your appointment, but also if there's an emergency situation and you're getting help from an EMT who has never met your child, you want to make sure to provide them with that information. Yeah.
Have a book, write it down. Write down your questions, write down the current med list, um, write down like activities that you might need clearance for.
Mhm.
If there's going to be sleep disruptions, how to handle that.
Yeah.
If there's medication refusal.
Mhm. Yeah,
Mm.
if you miss a dose for some reason, or if you give a dose and then the child vomits, for example, it's helpful to know what happened so you can communicate that clearly when you're in front of your provider to get assistance.
Yes. And I think we really enjoy working with the medically fragile population because it does require a stronger coordination of care and
Yes,
continuity of care.
strong collaboration across disciplines.
Well, that wraps it up for Acorns to Oaks today. What a great conversation. So lucky to have Nurse Sarah here to talk about medically complex individuals and their treatment care and ABA and some really important things to consider. So thank you again, Sarah, for
Thank
being
you.
here. Such a pleasure.
Ah.
Like, share, and subscribe. Thanks so much. See you next time, everyone.